Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Kami akan lanjutkan untuk SYMPO ke-11 mengenai safety dan quality control untuk fasilitas cyclotron. Now we are in the SYMPO 11, Kitiwat, about the safety and quality control of cyclotron facility. Will be led by Somanesen and Mr. Selamat Rizwandi.
Right. Okay. Thank you very much. Let me continue with my presentations. This is the objective or agenda for the talk. I will talk about radiopharmaceuticals being sterile injectables. In fact, this talk is rightly placed just after the last speaker. The last speaker had talked about GMP and how that can be practiced in the radiopharmaceutical synthesis, be it 1A, level 2 and level 3 as well. So I will dwell on the specific nature of radiopharmaceuticals, which require radiation hazard, as well as the aseptic aspects that are necessary, which was covered by the last speaker as well. Okay, so I'll talk about that. The introduction is basically this level 3, as what the last speaker mentioned, is GMP requirements. That means you need to meet the requirements stated by the PICS or the FDA, as was mentioned to you. Now, this specific mention about this PICS 1 and 2 basically refer to the PICS GMP. PICS refers to the European GMP requirements, all right? So the radiation safety still holds. Whatever we spoke about radiation safety still holds, even though it is a pharmaceutical, radiopharmaceutical, right? So in that sense, when you look at the fluorine-18, the half-value layer, we kept discussing this the whole week. Half-value layer is very different from that of technetium. So we need to take care of the differences between the two nuclides. Two different nuclides have different characteristics as well. Okay, and we need to account for the fact that the half-value layer for fluorine is as high as 4 millimeters. That means only half of the fluorine-18 is stopped when you have 4 millimeters of lead. So if you wear 0.5 millimeters, it's not doing anything for you, all right? It doesn't stop anything. It's very marginally stopped. So therefore, we are using tungsten versus lead in the case of 511 keV, in level 3C laboratory. Level 3B and 3A, you would also use some form of shielding, but perhaps when it comes to 3B, we are dealing with therapeutic radiopharmaceuticals, so the shielding can be a little bit lesser in comparison to gallium-68 or copper-64 based radiopharmaceuticals, right? So GMP basically, as this last speaker has mentioned, looks at all these aspects. I'm not going to cover all these aspects because that's not the focus of this talk. My focus is going to be how to balance radiation and pharmaceutical aseptic practices. Okay, the QA is a given importance, is a manufacture of radiopharmaceutical due to the low volume of production, because each time you produce, whether it's meant for 18 facilities or is it just for one facility, you still have to have a quality assurance program, and the total volume of synthesis is always 15 milliliters, for example. Right? Whether it's 5 curies in 15 milliliters or it could be 100 millicuries in 15 milliliters. The concentration varies, okay? But the requirements of GMP are the same. Okay? So with that, I just want to highlight that the non-GMP component of a PET radiopharmaceutical are the cyclotron and the nuclear reactor. Okay, whereas on the right-hand side, you see the synthesis modules, the purification stage, which is actually part of the synthesis synthesis module, as well as the final sterilization, processing, etc. These are the parts that are subject to GMP requirements. This is pretty much in any country as well, even whether it's FDA GMP or is it PICS GMP as well, right? Now, this is the manufacture of sterile products requires special requirements. For example, this is the grade that was spoken to you by the earlier speaker, grade A, B, C, and delta, right? And you can look over here at rest as well as in operation, the number of particles per meter cube of air. Right? So if you sample 1 meter cube of air, if you have a grade A, you must have even very much less number of particles inside it. That means basically these particles are dust particles, for example, all right? Or it could be bacteria as well, okay? So that size, and when we talk about 0.5 micron and 5 micron, so larger particles, you are allowed only 20, for example, in a class A environment. Okay, so they just keep that in mind. And then moving on, this is a facility of my department where we have the cyclotron, which is an unclassified room. In fact, it's a negative pressure. It's negative pressure because we want to make sure that whatever radioactive gas is produced inside stays inside there. It doesn't come out in comparison to, for example, the corridor. The corridor will be atmospheric pressure. This is a corridor, and that's atmospheric pressure. So cyclotron vault is always negative pressure. It's always ducted away. The air is being ducted away. But in the event that there's a radioactive gas discharge, for example, if a target ruptures, then the exhaust system stops, and you start flooding up this room with radioactive gas, right? But moving on, if you look at this red shaded portion is the clean room, all right? It is pretty much next to the cyclotron vault because you want to make sure that you are able to transfer the radionuclide that is synthesized in the cyclotron directly to the hot cells. So because we are dealing with high energy gamma rays, therefore the clean room, you cannot actually manually transfer the radioactivity between the cyclotron and the clean room, right? So it's automatically fed from the cyclotron to the hot cell in the next room. This is a blow up of my clean room. It's a very small clean room because Singapore is small and land is very expensive. It's one of the most expensive land price in the world, higher than Tokyo as well, and we therefore have to live on top of each other. And at the same time, you can see that we have 4 hot cells. The class A hot cells, the dispensing hot cell. On either side are the synthesis hot cells. Okay, we have synthesis hot cell to make the clean room, clean products. And then you have the change room over here, airlock or the change room, which is above that. You will see a class D and then the quality control room. Right. So with that, I want to highlight that monitoring of the clean room requires environmental monitoring. Environmental monitoring refers to settle plates, the use of settle plates, both for air sampling as well as for settle plates being placed there so that they can absorb the particles as well. And of course, you require such a device such as this. This is called air sampler, which actually sucks about a meter cube of air and throws it onto the settle plates to see whether there is any growth. Right? This is a good test, and our room is a class C, so you have a certain requirements. You must meet class C room, and if it doesn't, then it is a failure, and then you need to find a reason for this failure. And as I mentioned just now about the particles, this is the table in the PICS against the class of room A, B, C, and D. And here we are talking about the microbials or viable counts. Right. Now, these viable counts are actually determined settle plates, and by when I refer to air sample, that means you sample 1 meter cube of air, either in the class A or in the class C, and they must comply with these requirements. Now, ladies and gentlemen, it is almost impossible nowadays to comply with this class A environment. About 2 years ago, the PICS mentioned is less than 1. Less than 1, we still can have 1 growth of 1. I used to call 1 as the alert limit. And once I get alert limit, I just do some checking, and that's it. But now I can't. Now it is 0. Okay, so it's close to impossible. So we needed to change the HVAC system, which was quite old. We're spending $500,000 to improve the HVAC system for the clean room. Okay, and at the same time, we used to do alcohol-based sterile wiping, etc. But now we can't do that alone. We had to use sporicidal sprays and sterile wipes to try to accommodate this thing. So that has helped both the HVAC system as well as the introduction of the sporicidal cleaning, which is not done daily, but it was done once a month, has helped to alleviate this problem. Okay, so the environment and the operators must be also protected against the radiation. So whenever the GMP auditors have been coming to I've been handling GMP auditors for the last 25 years. So I've been, every year they come, they check us, and they always send a new set of auditors to us, and we have to educate them about the radiation aspect because they are not very familiar with radiopharmaceuticals. So our job is to educate them, at the same time be audited by them as well. So it's always a double-edged sword in that sense. And of course, the preparation of the radiopharmaceutical need to adhere to the regulations of radiation protection. So in the case of Indonesia, Papatan looks after the radiation aspect of your work. There is a department in the Ministry of Health which looks after the GMP component in Indonesia, right? Similar in my country as well. Radiopharmaceuticals should be manufactured in controlled areas because that's what the Papatan or the nuclear regulators would expect it to be, right? Because it's a control area is where you deal with high levels of radiation where the public does not have no access to, right? And then all manufacturing steps must take place in a self-contained facility within the hot cell. There is no reworking. Unlike the pharma industry, you cannot rework your product. Either you have, it's a binary sort of system where either you have a synthesis, a product, or you don't have a product that day. Okay, so there is no halfway, you cannot go and change, or you cannot rework like the product, okay? It's unlike the pharma industry. So measures have to be established and implemented to prevent cross-contamination. For example, you may be using the synthesis module for FDG and FAPI and also maybe PSMA, etc., right? You must make sure that no two products are synthesized at the same time. This is a big no-no as far as GMP is concerned. You cannot cross-contaminate. So you must make sure you have to validate your system to comply and show that you are not cross-contaminating your product, okay? So the best thing is many news facilities I have visited or I have planned for have got several rooms. Some rooms are meant for FDG. They may be small rooms, but they dedicate them for fluorine-18. Another one for solid targets, copper-64, the long-lived ones, etc. And another one for the therapy. So these small rooms, but they are next to each other. At the same time, the idea is to prevent cross-contamination. Cross-contamination, once again, is contaminating one product with the other, right? So, and then of course, closed or contained equipment should be used where appropriate. For example, your dispensing should be done in a very closed environment, as I mentioned, in a Class A environment, which must make sure that you have no introduction of Class C air or Class D air into it, okay? Right. So with that, hot cells should meet high degree of air cleanliness with filtered air. Recirculation of air extracted from the hot cell should be avoided because there may be some radioactive gas, and we don't want a recirculation of this radioactive gas back into the clean room, or for that matter, into the cyclotron facility as well. Okay? So it has to be ducted out. Carbon filters are very important because they are able to stop the radioactive gas and clean the air before the air is discharged out of your public. Okay? So this is something the Papatan would be looking for as well. Another thing is the airlocks, which act as pressure sinks. The way clean rooms are set up, they are positive pressure. So as the positive pressure, you move from the clean room into a change room or airlock, it is a slightly lower pressure. For example, the clean room could be 40 pascals. The next room, that is a change room, could be 20 pascals. Then after that, you have a air sink before you reach 0 pascals for the atmospheric pressure. So there's a cascade. There's a pressure gradient from the clean room to outside, right? So the purpose is you don't want unfiltered or unclassified room air to enter the clean room. So that's the reason why you are having a positive pressure for the clean room. Assembly of sterilized consumables, tubing, all these things should be also done in a Class A environment, such as a biosafety cabinet, perhaps inside the clean room or a room that is next to the clean room as well. Okay? Okay. So this is just an example of a cascade. For example, this is a clean room. I'm sorry, it's not very clear. It's plus 10 pascals, 0 pascals, and then minus 10 pascals. So that's the gradient, all right? So when staff enter, they enter from a 0 or negative pascals into 0 and then into a plus, okay? So that's basically what I was trying to say in the last slide. Okay, and this is an example of the fact that you cannot have pipes and pillars, for example, which are protruding. For example, something like a pipe like that you can see on this on the back of this room, the photograph here. Okay, this will pose a difficulty in cleaning. Whenever you have difficulty in cleaning, a cleaner cannot reach, it's not suitable for a clean room. A clean room should be a very simple room with smooth surface that can easily be cleaned. It doesn't need to have a very high ceiling, perhaps maybe 2.2 meters cukup, okay? And so that's easy for you to keep it clean as well, right? And no drain, certainly no sinks or drains. Now, this is where sometimes the radiation authorities like Papatan may say, oh, you must have a shower, emergency shower inside the clean room, which is totally a no-no, right? You can have the e-shower outside of the clean room, but certainly not inside the clean room because it goes against the principles of a clean room, okay? So washing should be provided at the first stage of the changing room. That's a compromise on radiation safety because radiation safety says that you need to have washing facilities next to the radiation area, like a injection room, like an uptake room, for example. That's okay, but not in a clean room. So these are hot cells in a clean room, for example, and this is 2 staff working in the clean room. This is a Class C clean room, so they are not wearing full suit, but they are wearing just disposable gowns in over their scrubs. Okay? And that is a view of the dispensing hot cell. Okay, so manufacture of radiopharmaceutical change or anti-room shall be designed as airlocks and shall have interlocking doors. So if you open one door, the other door cannot be opened, right? Because they'll make a sound or something like this to prevent both the doors being opened. Because if you open the clean room door as well as the anti-room door, what will happen is that unclassified air enters, right? So that's the reason why you don't want to open both doors at one time simultaneously. So you provide a physical separation of the clean room and the facility, and you want to minimize the microbial and particle contamination of the protective clothing as well, area for gowning. And in a clean room, a filtered air supply should maintain a positive pressure in the clean room. Adjacent rooms of different grades of air as well as different grades of pressure as well. Okay? So sorry, this example here is the wash or emergency shower, where you have a shower as well as eye wash as well. And this is outside of the clean room, okay, outside of the empty room where they do. So if there is a contamination, our SOP states that you walk out of the clean room to get your shower, etc., right? Now, let's look at it in a practical manner. Here you're dealing with hot cells. You have no direct relationship with the product, right? So your product is inside about 7.5 centimeters of lead separating you and the product. What is the likelihood of a contamination? You're not dealing with 1 liter of radiopharmaceuticals. We're dealing with 15 milliliters of radiopharmaceuticals that is inside a vial, right? So you have to think in terms of risk assessment. So this is how we explain to our nuclear reactors, our nuclear regulators, that there is a very slim possibility, or almost zero possibility of contaminating our staff. They are thinking in terms of a nuclear reactor facility where you can have about maybe 2 liters of heavy water, right? But we don't have that situation in a clean room because the maximum volume is 15 milliliters, okay? It's a very small volume and you're dealing with in the hot cell as well. So that's how we have to educate our regulators. All right, so manufacture of radiopharmaceuticals, monitoring of radioactive contamination, workstation environment should be monitored for radioactive contamination. Precautions should be taken to avoid radioactive contamination within the facilities. So one good thing is that we are dealing with fluorine-18. And what I mentioned a few slides ago is to separate your radionuclides. So you have one for fluorine-18, have one for the long-lived solid targets like copper-64, zirconium, etc., and another one perhaps for gallium. So the more separate rooms they are, even if one is contaminated, you can still use the others. So it's not a total shutdown of the facility. Okay, so that's the reason why we want to keep them separate. And also GMP auditors will be more than happy to realize that you have separate facilities to prevent cross-contamination. So routine monitoring, this is something that you can't forego. You still need to do your surveys and your wipe tests in the clean room as well, because especially you have to do a risk assessment yourself to realize which are the areas that are likely to be having a contamination. The contamination in my mind would be the place where the product comes out. You know, the product hatch where the radiopharmaceuticals falls into the lead container, that's a likelihood of contamination. So that's one place where you can do a wipe test as well. Okay? Next, I want to talk about the sanitation of the premises. Radioactive contamination needs to be checked prior to the sanitation. Before the cleaner staff or the cleaning personnel come inside, you need to check for contamination because you do not want to spread the contamination, right? So that checks are done before cleaning can be commenced. Clean room should be sanitized in accordance with the written SOP that you have for your facility. And of course, as I mentioned earlier, you may need to use more than one disinfectant because sometimes the bacteria or the fungi are familiar with one type of cleaning agent, and therefore you need to switch your cleaning agent every once in a while so that they don't become resistant to your agents, okay? And that's the reason why I mentioned that we need to use sporicidal agent to clean the facility once in a while, okay? So this, of course, we had to fight with our FDA regulator, not physically fight, but, you know, argue with them to impress upon them that it is not possible for us to use sporocidal because we goreng a bit lah. We say we don't want them to spoil our stainless steel. You know, sporocidal can stain and make your stainless steel dull. All right. So we tried to tell them. We said, "Tabule." They didn't accept it. So they said you must use. And in a way, when I think about it, yes, there is an increase in cost of production for me because I have to buy sporocidal, I have to buy sterile wipes to do this task. But in the sense that it has significantly dropped my environmental samples turning out to be contaminated. Right? So fumigation, because my facility is inside a hospital, they kind of frown upon fumigation, right? Fumigation is normally done with H2O2 or a peroxide, and it is not something that they allow us to use in a hospital, but some other facilities, private facilities, perhaps can use this fumigation using H2O2 or something to fumigate the place, not on a regular basis, maybe once in 6 months or so, or when they are having growth that is not going off, for example, that could be done. Okay. So another thing is the room monitoring. So I switch between aseptic practices as well as the radiation safety aspects for you to realize that every step of the way, you need to weigh both sides. They are like two cousins, you know, one cannot be sayang more than the other. So you must sayang both of them together, you know. One is the aseptic aspect and the other is a radiation safety aspect. Now, the decontamination kit, of course, needs to be set up, and it must be within the clean room or the quality control room. I would consider that a quality control room is where there's a higher likelihood of a contamination. So that room should have a decon kit inside a cupboard. You pull it out, and there is a Tupperware that you can pull out all those items that are shown for you in the middle photograph. Now, the photograph on the left basically shows you the decontamination room or the decontamination detector that is outside of the clean room. So I come out of the clean room, I check my hands, I check my baju, and then I walk out, right? I could use a hand and foot monitor, but that takes a lot of space and a lot of money as well to buy one. It costs about $60,000 to buy a hand and foot monitor, while I'm actually trying to do this with a pancake probe ionizing chamber, which is only about $3,000 or so, right? Okay. So next we talk about the warning system to indicate change in parameters such as airflow patterns, velocity, differential pressure, humidity. This is something is an aseptic requirement. When you're making a product, the in-process control needs to be monitored on a regular basis, okay? And that's where you have all these pressure sensors. I have my air particle, air sampling, and the inner pressure as well of the facilities. This need to be monitored. Now, my facility was set up in 2003. It's an old facility. It doesn't have the latest bells and whistles of a hot cell currently, all right? So over time, we needed to retrofit our facility to make sure that we meet the changing requirements of the GMP. Because GMP is not static, okay? They are ever changing, ever more demanding. Okay, when I first started in 2003, there was no need for air sampling or particle counting. There was no need for that. So we, therefore, the hot cell manufacturer, commerce or TIMA or whatever, when they sell you hot cells, there was no requirement or there was no features for us to do this kind of air sampling, right? So we had to retrofit the old hot cells to make sure that they can do this air sampling and pressures and the particles sensors. So this had to be, we had to modify our hot cells slightly, make holes here and there to make sure that we can comply with these new requirements, right? The temperature and humidity as well. So next portion I want to talk about is surface that comes in contact with radiopharmaceuticals are not, ensure that they are not reactive, they do not react with the product, and that's why we particularly use stainless steel in our systems, in the facilities. At the same time, we also use the usual sources, the vial sources, button sources, to do the quality control of our checks, of our dose calibrator, our MCA, etc. As well as, this is a picture of the radiopharmaceutical synthesis and dispensing at a time to prevent cross-contamination. This is a setup of one of them. And on the right-hand side, you can see the staff standing outside of the dispensing hot cell, looking through the lead glass to do some dispensing. This is a close-up view of the dispensing, and this is what I meant. I had to retrofit to fit this air sampler. And this little stainless steel bent L shape is actually part of a particle counter, right? So the detectors are outside of the clean air, right? They're only having the probes, that is the tubing here, but the device is below and external to the Class A environment. So this is something that we prefer to do as compared to putting a particle counter inside, and then we need to clean the particle counter because it's a Class A environment, etc. Sorry. 1 minute, okay, quickly. So I want to highlight quickly what's a laminar flow and what is a fume hood. This is a common misconception everybody has. What is the difference between a fume hood and a biosafety cabinet? For example, a laminar, what we have in a class 2A is a vertical laminar flow versus when you're dealing with radioiodine, then you use a fume hood, okay? This is a classic difficulty people have, even regulators have, and hence I want to show it to you, right? So difference between a hot cell and a shielded biosafety cabinet. So one is for 3C and the other one is for 2A, 2B as well, okay? So the production of radiopharmaceuticals, basically, we want to make sure that the labels have minimum information stuck on the vial, and on the lead container, you can have a bit more information, such as the activity, such as the volume, etc., right? Which is not found on the label for the vial. So manufacturer, the release of the radiopharmaceutical needs to basically comply with the requirements for the PICS or GMP requirements, where you need to ensure that the product has got past all the quality control, all the in-process control, etc. And QC has passed, then only can you release it. So over time, changing aspects, as I mentioned, of GMP, when we from 2003 all the way to now 2024, you can see more and more things are required of us, okay? So it's never static, but always changing. So I wish to summarize and say GMP is significant for radiopharmaceutical production. There is no running away from this. We should embrace the GMP requirements and make our radiopharmaceutical with a good quality so that we can service our patients with them as well. And we need to refer to specific guidelines from applicable GMP requirements, and the GMP guidelines present control of multiple aspects of manufacturing. They're like validation, quality control, etc. And adherence to GMP is mandatory, and we need to comply with it before we can actually release our products. And production and release of pharmaceutical for patient use poses considerable challenges for a facility, and it's also expensive as well. All right, there is a lot of cost incurred while we need to do all these things like environmental monitoring, etc. So these are my references, and these are some of the Indonesian institutional visitors who visited my facility, Bapatan, the FDA, and also sometimes the private companies like Calbe have also visited our facilities before they start GMP auditing all of you. Okay. Okay, so that's my last slide. Thank you.
Thank you so much for your nice presentation. Because of the time, we have a limit time and already over around 10 minutes. Maybe if the participant have the question, can send to the committee and then the committee will be sent to Mr. Soma. Now I need your help, Ms. Nur, to come the front to give the yes, I need your help now. To give us some souvenir from the committee to Dr. Soma. Dr. Soma, please. Baik, terima kasih Ibu Nur. Selanjutnya kita masuk kepada pemateri berikutnya, yaitu Pak Slamet. Ininya apa ya? Pak Slamet mengenai apa ya?
Ini ion source maintenance.
Waktunya sampai jam berapa?
Harusnya
3:35. Untuk pembicara berikutnya, Bapak Slamet Rizwandi yang dilahirkan di Jakarta tanggal 13 Februari tahun 78. Saat ini bekerja sebagai Service Engineer for Radiotherapy and Nuclear Medicine di Rumah Sakit MRCC Siloam sejak tahun 2015 sampai sekarang. Pak Slamet, karena waktunya yang sangat terbatas, saya minta maaf, jadi hanya diberikan waktu sampai pukul 15.35. 15.35. Ya Pak, waktu dan tempat saya persilakan.
Assalamualaikum warahmatullahi wabarakatuh. Selamat sore semuanya. Boleh diklik Bang? Di MRCCC kita ada Cyclotron, mesin Cyclotron yang mempunyai dual proton sebagai ion source-nya. Dulunya kita punya ion source itu untuk yang satu penghasil proton, satunya deuteron. Cuma karena deuteron kita jarang pakai, kita ganti dengan yang proton. Jadi satu bisa dipakai untuk backup. Di sini ada, boleh Bang, videonya yang di Cyclotron. Di sini ada, kita punya Cyclotron, ada 8 exit. Kebetulan kita punya 4 exit yang bisa digunakan. Kita ada 4 target. Jadi yang kita gunakan tuh di exit 1, 2, 5, dan 6. Kita punya jenis-jenis targetnya itu yang satu yang conical dan yang satunya silinder, 2 pasang. Eh, untuk slide berikutnya, Bang. Di sini tingkat efektivitas hasil radioisotop karena cyclotron kita akan digunakan untuk menghasilkan radioisotop F18 atau fluorine. Ini dipengaruhi oleh beberapa sistem utama, yaitu antara lain adalah ion source. Kemudian di bagian keduanya adalah extraction system, dan kemudian adalah target system. Next. Ini cyclotron di bagian dalam. Ini ion source-nya, extraction system, dan targetnya. Boleh diklik lagi, Bang? Nah, ini pada posisi inilah di ion source ada di posisi ini, kemudian extraction time, extraction systemnya ada di bagian sini, dan target. Jadi secara kerjanya kita di dalam chimney ini ada chimney, itu diberikan gas hidrogen, kemudian diberikan tegangan ekstra tinggi sehingga dia terion, dan ion itu akan ditarik oleh puller di bagian sini. Dan puller ion itu akan diputar sampai dia berenergi 18 mega electron volt. Ketika sudah energinya sampai 18 mega electron volt, ini akan diarahkan oleh stripper. Jadi fungsi dari stripper ini mengarahkan agar berkas proton yang dihasilkan itu akan ditembakkan ke target. Di target ini kita isi dengan O18. Dan ketika proton ditembakkan ke target yang sudah berisi air O18 akan dihasilkan F18. Oke, Mas, lanjut. Nah, ini beberapa bagian ion source yang akan kita dipelihara, artinya dirawat agar dia mempunyai masa lifetime yang lebih. Biasanya kita melakukan perawatan itu sekali dalam sebulan. Beberapa part yang disposable, antara lain yaitu katoda, kemudian chimney, dan bagian o-ring. Boleh lanjut, Bang? Nah, apa yang kita lakukan, ini adalah menginspeksi bagian-bagian seperti katoda. Itu kita lihat di sini beberapa katoda yang dalam waktu kurang lebih sebulan sudah mengalami degradasi, ya, maksudnya dia ditumbuk oleh tegangan tinggi. Ini bentuknya mulai cekung. Kemudian juga chimney dilakukan penggantian tiap 5 bulan. Di sini kita lihat beberapa kerak, ya. Ini hasil dari meltingnya katoda yang jatuh, dan ada kerak-kerak juga. Biasanya kita gunakan kikir untuk ngebrush, jadi di cleaning bagian-bagian chimney yang sudah mulai kotor. Kemudian ada o-ring. O-ring juga kita lakukan penggantian tiap 1 bulan sekali. Nah, ini fungsinya o-ring ini yaitu agar gas H2 yang di dalam ion source tidak keluar kemana-mana. Kalau dilihat dari sini, dia akan diusahakan agar gas hidrogen tidak keluar ke arah sini, tetapi melainkan ke arah ke slitnya. Next, Bang. Nah, ini beberapa sebenarnya ini bukan di chimney-nya, tapi di bagian di bawahnya chimney. Ini biasanya kita temukan kerak-kerak hitam. Ini biasanya kita bersihkan, kita kikir dengan kikir sampai dia kembali bersih, paling tidak terlalu kotor. Lanjut. Nah ini kita positioning katode, fungsinya biar dia align. Jadi di ion source ini terdapat 2 katode yang dia harus align, maksudnya atas dan bawah itu sama. Jadi ketika ada tegangan tinggi, dia akan mengionisasi H2. Boleh Bang di videonya? Boleh.
This is ion cathode. We use a jig to align it. The ion cathode.
Nah nanti katodenya akan dimasukkan ke dalam ion source. Jadi ada ion
source.
Katodenya tuh ada 2 di atas dan di bawah.
That produce photon.
Nah ini bagian lain yang posisi alignment untuk katodenya. Posisi katoda dia seperti ini dan fungsi dari jig yang di putih ini fungsinya yaitu untuk dia tidak tilting. Katodanya posisinya akan datar seperti ini. Lanjut, boleh? Nah, ini salah satu juga metode yang kita lakukan untuk positioning katoda agar dia benar-benar fungsinya posisinya ada mendatar seperti ini. Ya, Bang. Ini juga positioning si katoda di dalam chamber plasmanya. Jadi kalau bisa kita usahakan posisi chimney, posisi katoda berada di center. Lanjut Bang. Ini adalah inspeksi ketika kita sudah pasang katoda dan wiring untuk katodanya. Untuk anodanya biasanya ini di chimney. Chimney itu berfungsi sebagai anodanya dan yang plat katoda. Boleh Bang? Ini kita sebelum kita masukkan ion source nanti ke dalam cyclotron, ini kita uji konektivitasnya antara katoda dengan anoda.
Yang positifnya nih.
Dulu pernah kejadian ada kikir yang ketinggalan. Jadi
Konektivitasnya naik.
kikirnya itu kontak dengan chimney-nya. Jadi ketika pas kita masukkan ion source, kemudian sudah divakum, ternyata ada tegangan tinggi langsung melonjak gitu. Nah pas kita ke dalam, itu pemvakuman butuh waktu sekitar 3 jam. Jadi ketika pas diuji coba ternyata ada tegangan yang terlalu tinggi atau spike. Nah terus kita ke dalam, kita buka lagi unvakum dan kita periksa ternyata ada bekas kikir yang ketinggalan.
Jadi satu.
Boleh Bang, lanjut. Ini kita inspeksi juga chimney slit. Ini chimney slit yang masih relatif bagus. Ini kelihatan, ini kita zooming pakai makro, jadi posisinya ini masih relatif mulus. Biasanya untuk chimney kita ganti di tiap 5 bulan sekali. Nah ini karena kita masih bagus, ini hanya dibersihkan di bagian pinggir-pinggirannya yang terkena meltingan dari katode. Lanjut boleh Bang. Nah ini ketika kita memasang ion source di dalam cyclotron, di situ ada puller sebagai penarik protonnya. Dan ini slide chimney yang tadi posisinya pas kita inspeksi itu masih relatif bagus. Ini kita posisikan dia posisi di tengah. Lanjut. Ini pada saat positioning juga kita ukur berapa gap antara chimney, ini chimney-nya, terhadap puller. Untuk toleransinya di gapnya sekitar 1,8 sampai 2 mm menggunakan filler gauge. Boleh langsung, Bang? Ini beberapa failure yang pernah kejadian di rumah sakit kita di Cyclotron. Di sini ada katode yang diberikan tegangan ekstra tinggi. Ini ada kawat yang melengkung dia. Seharusnya dia posisinya lurus. Ini dikena berkas protonnya. Karena dia melengkung, kemudian ada proton yang dipercepat ke sana dan dia menghantam pinggiran kabelnya sini. Ini untungnya kita sempat mengetahui ini, jadi kita buka lagi cyclotronnya, unvacuum, kemudian dibenarkan posisinya seperti di bagian bawah. Boleh lanjut, Bu? Beberapa failure juga terjadi di titik hubung antara kabel dengan ion katode. Ini terkadang hubungan yang titik ini kadang sambungan timahnya sudah mulai putus. Jadi beberapa kabel sudah kelihatan putus. Nah ini biasanya kita fix dengan timah lagi, resoldering. Boleh, Bang? Jadi summary-nya dengan maintenance routine yang dilakukan diharapkan kita bisa memperpanjang hidup part-part di bagian ion source. Ion source itu ada beberapa part yang seperti chimney dan katode. Kemudian kita juga mencoba untuk membalikkan posisi katode. Jadi katode yang sudah bagian atasnya cekung, itu biasanya kita balik lagi dan bisa kita gunakan untuk berikutnya. Kemudian banyak kerak yang terbentuk akibat pembakaran di chimney. Jadi di chimney juga terjadi pengotoran, yaitu pengotorannya bisa disebabkan oleh gas hidrogen. Kita memakai gas hidrogen itu dengan puritas 99,99999, 0,95 kali di bagian belakang. Diharapkan dengan puritas yang tinggi, kerak-kerak yang di chimney akan lebih sedikit. Pembersihan pada dinding ion chamber juga, maaf ini salah tulis. Pembersihan pada dinding chimney akan menaikkan efisiensi pembakaran di chimney. Kemudian repositioning katode, yaitu memastikan katode berada di tengah-tengah sehingga pembakaran atau hasil plasma proton bisa maksimal. Kemudian kita juga mengusahakan repositioning ion source dengan gap antara 1,8 mm sampai 2 mm untuk menghasilkan penarikan proton ke arah puller. Kemudian penggantian O-ring di bagian katode itu mencegah leaks gas hidrogen yang akan kita bakar di chimney ke arah yang supaya dia tidak ke arah kemana-mana. Dari terakhir saya terima kasih. Kalau ada pertanyaan, mudah-mudahan saya bisa jawab. Terima kasih.
Baik, terima kasih Pak Slamet atas pemaparannya. Berhubung masih ada waktu, dari audiens ada yang ingin ditanyakan? Oke, Mas Ifun.
Iya Pak, izin bertanya, saya Ifun. Saya tertarik sama yang ion source ini kan sebagai salah satu part yang akhirnya memberikan dampak apakah hasil yang dihasilkan oleh Cyclotron itu besar atau kecil ya, atau maksimal atau tidaknya gitu. Nah, untuk katoda sendiri apakah ada indikasi yang bisa Bapak lihat kapan si katoda itu bisa diganti atau bisa di-keep dulu untuk dipakai lagi gitu? Baik, terima kasih.
Baik, kalau kita biasanya ada rutin untuk melakukan maintenance itu di 1 bulan sekali untuk pengecekan apakah si katoda itu sudah benar posisinya di tengah atau dia miring ke kiri atau ke kanannya, juga itu perlu dipastikan. Tetapi biasanya kalau yang kita lihat itu dari parameter di Cyclotron itu ada kayak di ruang operator itu ada pop-up probe current. Di situ kalau nilainya dia sudah turun, artinya di plasmanya di dalam chimney plasma yang dihasilkan itu di protonnya sudah turun. Nanti kita bisa lihat pop-up probe-nya akan turun juga. Ketika dia turun artinya berarti kita perlu lakukan pengecekan atau pembalikan katode, atau kalau memang perlu kita ganti baru katodenya. Demikian.
Kalau dari segi performa, apakah ada perbedaan antara kita ganti baru sama kita membalikan katode?
Kalau dari performanya itu akan, kalau dari eksperimen itu akan lebih banyak signifikan kalau kita penggantian chimney-nya. Itu akan menaikkan nilai pop-up current yang artinya pembakaran bisa dioptimalkan. Cuma kalau untuk katoda sendiri saya rasa dia akan meningkat, cuma peningkatannya tidak signifikan ketika kita compare sama penggantian chimney-nya. Begitu.
Baik, terima kasih. Kalau misalnya ada tambahan pertanyaan bisa dilanjutkan memberikan pertanyaan kepada panitia karena waktu juga ya yang membatasi ya. Nanti bisa disampaikan ke panitia dan panitia akan meneruskan kepada Pak Slamet. Pak Slamet mohon bisa berdiri di sini dulu. Terima kasih dan wah ini nggak ada ya. Mungkin kita bisa memberikan apa nih ya? Memberikan Ibu ngasihin aja. Oh ya. Baik, rekan-rekan semua, dengan berakhirnya dengan ditandai penerangan souvenir kepada pembicara kita yang kedua, maka berakhir juga acara untuk simposium ke 11 dan 13 untuk di ruangan ini, dan saya mengucapkan terima kasih. Mohon maaf yang sebesar-besarnya bila ada dari saya sendiri ada kata yang tidak saya sengaja. Dan saya ucapkan sekali lagi terima kasih, dan acara ini saya tutup dengan wabillahi taufik wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Teman-teman semua bisa menikmati coffee break